Welcome to another episode of 90210 Doctors. Thank you so much for joining us today as we will be discussing a topic that is probably affecting you, has affected you, will affect you. That's right, we're talking about one of the most important and most often compromised joints in the body, something that might be hurting you as we speak. We're talking about knees on today's shows. So we're going to talk a little bit about knee pain, what causes knee pain, and different treatment options for addressing those issues. So doctors, I know, I myself have had 2 knee surgeries and I am only 33. So let's get right into talking about
God
knees.
or nature, however you view this, to give us so much flexibility. Look what ballerinas can do. Look what martial artists can do. To have so many degrees of freedom. God had, or nature had to make the knee very delicate. And because there's so many degrees of freedom, a lot can go wrong. So we got to take care of these joints because, cartilage is finite.
Yeah, absolutely. And Dr. Belcher, as our resident orthopedic surgeon, how often do you see knee problems?
Well, knees probably is the biggest part of my practice. From young athletes, and speaking of ballerinas, I've taken care of professional ballerinas for 9 years, a company in San Jose, California. Also I take care of older patients who have knee replacements. So I see the whole scope of knee injuries and the treatment. Today on this show, we're going to have Dr. Nat Cohen, and we're going to go into more details about knee surgeries.
Super smart guy.
Yes, knee surgeries and the rehab that goes along with it.
Yeah, absolutely.
Just to finish the segment, most martial artists end up with total hip replacements. And all the senior ballerinas I know all had hip replacements and joint surgery. So we got to take it serious, people at home, and we're going to give you all the tips on how to keep healthy joints.
Absolutely. And I see that sort of compounded in my practice by people who are overweight. And so we'll kind of get into that later as well, because our joints
Always comes back to diet.
Yeah, it always comes back to diet on this show. Our joints are so fragile, and there's so much weight bearing that happens on specifically the knee joint. And although we think of the knee bending just this way, there's also a little bit of torque that happens in that joint. So if you have more excess body fat on your frame, that's going to put increased pressure
And all that
on your knees as
flexibility
well.
comes with a price, which is delicacy. So we got to take care of our joints.
Absolutely. So we will be joined in our next segment by Dr. Cohen, who is an orthopedic surgeon and a sports medicine specialist. He's going to tell all about knees and what he's doing in his practice to help combat
And he's going to do the splits just to show us that he lives what he preaches.
Dr. Ray has made that promise. We have not checked in with Dr. Cohen yet.
And I kept it 2 episodes ago.
But he'll be with us right after this break.
Welcome back to 90210 Doctors. It's my pleasure to welcome our special guest, Mr. Nat Cohen, Dr. Nat Cohen. Dr. Nat Cohen and I are colleagues and friends of more than 20 years. Dr. Nat Cohen trained at Columbia University in New York, so another Ivy Leaguer.
That's a very nice junior college. Coming from a Harvard guy. Just kidding.
Well, as a former Yale, I've got to say,
Boom, bada bing.
we have a tiny rivalry.
Yeah, just a tiny, right?
It's,
For residency or medical school?
both.
Wow, that's intense. So this guy's good, people. That means he's good. Continuing.
So Dr. Cohen, subspecialty is in sports medicine. I kind of evolved.
See, defended you guys. Did you watch that? And I want to get back to this. It's become a tradition to choke our guest. But he is also a 2nd degree black belt in Taekwondo. And maybe we'll get back to that, how important exercise is to maintaining healthy joints.
Oh, it's vital. It really is. And that's actually what got me into sports medicine, is I fenced for about 20 years.
Wow.
And
Classic Ivy League guy.
I got injured enough times. This is classic New York, actually. There's no other place. You have to do an indoor sport. And I got injured enough times, and I realized the rehab was fascinating. And looking at how you get better from injuries, how you have optimal performance that's all. Honestly, if I hadn't done sports medicine, I would have been a coach.
Yeah.
And the two are really the same. I mean, you're trying to get people to be at their best.
Yeah. And what do you think is the most common misperception when it comes to joint health and what you're seeing in your clinic?
I think the most common misperception is that you don't have to do anything, and that you don't take responsibility for what you do. When I tell all of my patients, 50% of your success is going to come from what I do, and at least 50% of your success is going to come from what you do. And it's either in the rehab, it's your attitude, it's how you approach your recovery as, is this something that's going to hold me back, or is this something that I'm going to get stronger from?
Hey, Doc, sorry, go ahead.
No, I was going to say I'd love to give you a megaphone to say that a little bit louder for all of my patients, because this is what I preach all the time. They think, oh, the doctor said that the surgery went great. But if you don't do your rehab and you don't take ownership on that part of your rehabilitation, you're not going to get better.
Actually, I tell patients that, if I do your hip or your knee, that's 30%, even if it's done technically
Same in
perfectly.
plastics. Yep. Same in
And
plastics.
70% is your efforts in rehab.
Two things, Doc. They know Latinos were always very religious, or nature, however you view this. Isn't that amazing that all machines, the more you use, the more they wear out? We're the only machine in the universe that the more we use, the better we get. And that's why plastic surgeons you see on television, we hug our patients because of 50-50 marriage. We do 50% if they don't do their part, which is walking, coughing, hyperbaric. If they don't take care of what I do, eat the correct diet, high protein diet, they're not going to heal. So it's a marriage. And patients don't understand that.
We're working as a team, and
Yes.
the most important thing is making sure that everybody understands that we're all working together. And I'm there to help, but I'm really their coach. I'm the mechanic, but I'm also the coach.
Doc, so if maybe we can start with the pathology. What is the pathology that most damages the knee joint? We're speaking specifically of the knee joint. What is happening to the cartilage? Is cartilage replaceable? What is happening in that joint?
Great question. So, as somebody who sort of thinks like a mechanic and structurally, let me show you a quick model so we can go over what's in the knee.
You see, I'm not the only one who brings props, people. They're always making fun of me.
So when you look at the knee joint, you've got your muscles around here, you've got your bones, and then the lining of the joint is the cartilage. And that's
How thin, doctor? Because I really want to impress home that weight gain is a problem. How thick is that finite cartilage?
it's not that thick, and I mean the knee.
How many millimeters?
That I don't know.
2 or 3. It's not much more than that.
Exactly.
So it's you guys, if you don't watch your weight, think about it. The physics of the joint is 4 times. So you gain 10 pounds, you've actually gained 40 pounds across that joint. So again, we're back to health, diet and taking care of yourself. It's a lot of vectors of force going across that joint if you don't watch your weight.
Absolutely. And there are a couple of things that really help protect the cartilage. So you essentially have the cartilage, which is the critical part, but you also have the ligaments that keep the knee stable and allow the cartilage to function well. And then you've got the meniscus, which is essentially the shock absorber that sits inside the knee.
So let's talk about, since we're talking about meniscus right now, the most common thing I hear is the patient will come to me and say, well, the doctor says I've got bone on bone. There's nothing I can do about it. So explain, because I don't think patients actually know what bone on bone means.
And how the x-ray is not always correct. You can have bone on bone and have no symptoms.
You're looking at somebody who does. I've got bone-on-bone arthritis in my knee, and yet I still am able to do martial
So we don't
arts.
treat the x-ray. As they told us in medical school, we treat the patient, not the x-ray.
So what bone-on-bone is? It's essentially what you see on X-ray, where the two bones are touching, and it can either be on the inside part here, the outside, or in the kneecap. And that's what. By the time you get to bone-on-bone, that's. I'm going to be sending my patients over to Dr. Belcher to do joint replacements if rehab doesn't work.
So it's not, so when we get x-rays, it doesn't diagnose arthritis from x-rays. You can't see arthritis on x-rays, right?
Right.
So at the end of all bones, lone bones that make up joints, you have articular cartilage. Articular cartilage is a unique tissue made of 80% water. It's kind of the consistency of rubber. It's not dense enough to show up on x-ray. the most basic definition of arthritis is loss of articular cartilage. And so on x-ray, we know that you're bone on bone because the two bones come together.
Mm-hmm. And what's the circulation of cartilage, doctor? Trick question. There is not, people. There is not. So you got to take care of your joints.
Yeah.
And also no nerve supply, which also makes it, and because of those reasons is why articular cartilage, when you lose it, doesn't regenerate. And that's why we have end-stage arthritis.
Doc, what's the importance of collagen in your diet? Hyaluronic acid and collagen. A lot of products being sold with collagen, 1, 2, 3. What's does it help or does not? People at home would like to know.
You know, the short answer is I don't know. And
Your visceral instinct?
my visceral instinct is it's got to help.
It's got to help.
You know, and having a healthy
Plus it's
diet,
also-
having, being active is really the critical thing to maintaining your joints throughout your entire
And
life.
for you guys, it's collagen 3, right? For us, it's collagen 1.
Collagen 1 also plays a role in articular
No way.
cartilage as well.
Buy your collagen supplement.
And everything again has circled back to that all-important diet and exercise. So moving your joints, even when you're experiencing pain, even when the doctor has told you you have bone on bone, still continuing to move is important.
You know, as a human being, you're nourished by moving, and you see this in patients who are older, that if they move, they're active, they're alive, and once you stop moving, it's very, very difficult.
As a matter of fact, even vis-a-vis very, very massive trauma with a plateau fracture, many times, at least we see this in the hand as plastic surgeons, sometimes movement, nature is so wise, you'll remold that joint just by moving.
Right.
Excellent discussion. We're going to go to break right now, and we'll return with more 90210 Doctors.
My dear friends, you've come to the correct show. Welcome back to 90210 Doctors. We're talking about orthopedic problems today, specifically joint problems, the knee more specifically. Did you know that 80% of all people are going to suffer some orthopedic problem in their lifetime? Doc, so this conversation today is super crucial. I cannot think of a better specialist than you.
Oh, thank you so much.
World class. Eventually we're going to finish at all the options today in orthopedics and then what's in the future. But I want to talk a little more about prevention because a lot of our people that watch us, they're not quite there yet. I want to talk about a little bit very quickly, if I may. We talked about diet. We talked about supplements. How about exercise? During the break, Dr. Belcher was talking about how the synovial fluid, the movement of synovial fluid increases with movement. What is the role of exercise in preventing joint damage?
So exercise is critical because the more active you are, the more the joint gets nourished. Also, I think maintaining your strength and maintaining your core strength is vital. One of the things that we've seen is that when people get injured, a lot of the time it's due to core weakness. And in fact, one of the godfathers of sports medicine, James Nicholas, back in 1969, talked about the idea of linkage. And the idea of linkage is that when your core is weak, and this is before anybody was talking about core, is that if your core is weak, that's when you start to get knee injuries. And he was an incredible pioneer. Every time I sit down and people say, well, my leg is hurting, and I said, you got to strengthen, you got to strengthen.
Pass me your model here. Is that the reason why the muscularity around this model here, suggested by these ligaments and tendons, almost looks like a brace?
Yes, exactly right.
So the more developed your muscularity, which is 360 around this joint, the more supported your joint is, less likely to get knee damage. Is that correct?
Absolutely. And it's also, it allows you to have a balance. The whole trick is to have balance in your joints. And the stronger you are, the more balance you have.
Everything you're saying is music to my ears because this is what I tell patients every day when they come with the bone-on-bone arthritis. I say, well, we need to strengthen the muscles surrounding the knee so that less pressure is on the joint of the knee. Strengthen the hips as well, which is one of the core musculature. Because the less strength and stability you have in your hips and in your core, the more torque is going to happen at that knee joint, which is then going to compromise all of these ligaments.
It's interesting because I've had patients who've felt that their knee was unstable and may have thought they had an anterior cruciate ligament tear or something, and it really turned out that they have weak quads. You don't realize, but your quadriceps, hamstrings, they're secondary stabilizers. And so particularly if you have weak quads, you may feel like you're going to fall or have difficulty going up and down stairs. So
What I found too, go ahead.
Go ahead.
I was going to say, what I found too is that there's an imbalance in the strength between the hamstrings and the quadriceps, which I think is what I fell prey to when I tore my ACL some 15, 17 years ago and tore it twice.
Well, it's really interesting when you look at the rate of ACL tears in women. It's 6 times to 9 times higher than it is in men.
600%.
And the reason why we had theory after theory after theory, and finally it was a physical therapist who looked at the way that women tend to land, and it was a muscle issue. And by jump training and training young women how to land correctly, the ACL tear rate reverts back to that of men.
Doc, which brings us up. The athletic industry is enormous, and there's some myths out there that you can't touch on. It's taboo. High impact exercise. I watch Desi swims, low impact. I bike, low impact. I watch my neighbors, which are frequently overweight and are just the weekend warriors, on thin soles, banging it on their jogging. What is the truth for our viewers at home? Because this segment is about solutions. What is the truth about high impact? Is it better to bike and swim, or is jogging the way to go?
You know, a lot of this comes down to how you're constructed. So somebody like me, I'm not constructed to be able to jump and land heavily time after time after time. On the other hand, you look at marathon runners who are, who are not that large, and they can run forever. So.
Well, let's talk about Wolf's Law then. Is it not true the more you use it, the stronger it gets?
Absolutely.
The bone actually gets thicker, right?
Absolutely.
That's specific to bone. Does it have the same effect on something like cartilage?
Cartilage, if you've got some sort of imbalance and you're wearing out and you're putting a lot of load on it, it's going to wear out. It's like having your tires out of balance.
Doc, so now we talked about pathology, we talked about some of the home-based solutions, but let's talk about the damaged knee. What is this about ACL, cruciate, meniscal repair? How do we do it today? And then if you could talk about the future.
Sure. Well, Desiree, I'm sure you have vast experience going through an ACL. So just to let everybody know what the ACL is, it's one of the stabilizing ligaments inside the knee. And one of the challenges with naming knee ligaments is that they all have CL in them. Yeah. But you've got the two outside ligaments called the collaterals, and then you've got the two crossing ligaments inside called the cruciates. Cruciate is Latin for crossing. And you've got the one in the front, the anterior cruciate, and then the one in the back. And the ACL is the main stabilizer for sports. And when you're going to do cutting sports, you need the ACL. And usually the way that you injure it is you catch your leg and it twists. 70% of the time, there's no contact. And as you can attest to the fact, it is a fairly painful injury. I saw this with my black belt instructor, who landed awkwardly from a jump and tore his ACL.
Wow.
And we carted him off to the hospital, and luckily he didn't have a fracture, but we ended up fixing him. And it is a critical ligament to help you get back to sports and be active.
Now, when I had my ACL reconstruction, again, years ago, the first time I used one of my hamstring tendons, the second time I used a cadaver graft.
Yes.
So can you talk about the different options when it comes to an ACL reconstruction, and maybe how far, I hope, technology has come since then?
Absolutely. So unfortunately, the environment of where the ACL is, up until recently, has precluded actually doing a repair. So back in the day, when people tried doing repairs in the 60s and 70s, there was about over a 50% failure rate. Wow. So in the mid 80s, we were able to pioneer reconstructing. So taking a piece of tissue and then using it as the ligament itself. And I always tell my patients, to a certain extent, there's really no free lunch. So you're going to take a piece of tissue from your own body and that may weaken that one little part, but you need it. And so what you do is you take out the old ACL, you harvest a piece of tissue like your hamstring, and then you drill 2 tunnels in the bone and you fix it in place. And there are a number of different things that you can use. You can the original way that people used it was a strip of the patellar tendon with 2 pieces of bone, and then you can use your hamstrings. You can use the quadriceps. Each one has their own pluses and minuses, and then you can use cadaver tendon. The only issue with cadaver tendon is that in younger athletes, they tend to feel pretty good and go back too early, and there's a much higher failure rate.
Doc, as a plastic surgeon, of course, women have these beautiful dresses, mini skirts. The scar today has gotten a lot better too, right? Because is it endoscopic?
So you have to have an incision if you're going to harvest, but everything else it's through small incisions. Now, some of the really interesting technology that's coming out is the idea of now being able to actually do a repair. So this is a little controversial, but there
This
is.
show's controversial. Don't worry.
So as much as I went to Yale, I do have
Oh
respect
my
for some
gosh!
people
What a great junior college. Yes, Yale.
who study at Harvard, and there's a surgeon at Harvard, and she pioneered the use of having a collagen implant into the ACL.
With no scar. Doctor, we're going to cut the commercial on that beautiful new technology. My dear friends, we're going to be back with 90210 Doctors in just a second with the non-scar solution.
Hi, my name is Dr. Nat Cohen, and I'm from Los Gatos, California. I ended up in medicine with my involvement in sports. I fenced probably for about 20 years, and in the course of this, got injured a number of times and realized how fascinating medicine was. And the more I got injured, the more I saw this, the more I realized just how amazing the human body is. I had knee and ankle and shoulder injuries just like most athletes, and really came to appreciate what it's like to have a healthy body and how important it is to be able to restore that health. I'm a sports medicine specialist, so I specialize in athletic injuries, and I also do a lot of work in the knee and the shoulder. So the most common treatments we see are actually non-operative. So we'll do therapy and lifestyle changes in order to get people better. It's really only if people have tried these and it hasn't worked that we think about doing surgery. So the most common types of surgery I do are minimally invasive surgeries using the arthroscope. So it's a small fiber optic scope that we look into the joint, and we'll use this for the knee, the shoulder, the hip, and look inside the joint and then address the problems that we've got. In knee injuries, the most common issue that we see are probably meniscus injuries. The meniscus is a small shock absorber that sits inside the knee, and when it gets torn can be quite painful. And then in terms of ligament injuries, the most common injury that we see is an intercruciate ligament or ACL injury. So a candidate for knee replacement is somebody who has arthritis and somebody who has tried all sorts of non-operative treatments, including bracing, activity modification, physical therapy, injections, but still has pain. And they would then be a great candidate for a knee replacement. I would say probably the knee injury, just because you use your knees so often, and in any sport you're going to do, you're placing some sort of stress on the knee. So ACL injuries are different from MCL injuries. The MCL is one of the ligaments on the side of the knee. It's very commonly injured, but it heals on its own because the body is able to form a clot. With the ACL, it's inside the knee joint, and so you really have to do something to either reconstruct it or protect it while it's healing. So weight can play a large role in it, and I'll tell everybody that your body sees 3 to 4 times body weight as your knee sees 3 to 4 times body weight as it's going up and down stairs. So every pound that you lose means that your body is seeing that much less force across the knee. So having a lower weight really allows you to recover. Now, if you're a defensive lineman, you're gonna be heavy, but that's okay. When people talk about having their knee give out or instability, it really can come from a number of different things. Now, a ligament injury is a very specific injury that you know happened. It's rare for somebody to come in and say, I've got some instability, and their ACL is torn, but they don't remember it. Whereas if somebody has a sense of giving out, sometimes it's just quad weakness. And I've seen this after hiking for a long period of time. You start to walk afterwards and your knee just doesn't want to work. There are several different types of cartilage in the knee. And when people often say, well, I tore my cartilage, they're talking about the meniscus. But when we think about cartilage, it's really the articular cartilage. And that's the covering that you see on the end of any bone, and it allows your joint to move back and forth so smoothly. And it's an amazing structure. It's got a very low coefficient of friction, something on the order of water against ice, and it allows the joint to slide back and forth so smoothly. The problem is that you only get a limited amount in your life, and it doesn't grow back if you get an injury. When you should start to think about seeing somebody is if you've had an injury, and if that, absolutely you should go see a physician for that. And in addition, if you're having pain and you've tried a number of treatments, maybe for a week or so, but it's still bothering you, it's probably a good idea to get it checked out.
You guys know who the patient advocate on this show is? The Latino brother. Welcome to 90210 Doctors, and we love your questions. We love this interaction with you. Thank you for your questions, and we always have the best of the best of the best of the best. So, question number one from our wonderful viewers. When you use tissue bank, is there a threat? That's a great question. I was thinking about that. How do you deal vis-a-vis cadaveric tissue? How do you deal with HIV, hepatitis, et cetera, not to be transmitted to the patient?
Great question. So when you're looking at ligaments, there are a number of ways that you can use to really protect this. And when I started back in the early 2000s, there were a couple of people who actually died from infections. Now, the risk of it at that time was about 1 in a million, so very, very small. There's newer technology out there that allows you to actually sterilize the grafts. So the grafts that I use have been processed to the point that they're considered medically grade stable.
Is it radiation? How do you radiate the cadaveric tissue?
So you can radiate it, but radiated tissue is a little bit weaker. The tissue, there are other tissue processes where you're flushing the tissue out. Plus, the other thing is we've gotten much better at testing. So every donor is tested, and you wait on the tissue. So right now, I would say that it's a theoretical risk, but it's a very, very, very low risk. Your chance of getting HIV from a cadaver is probably less than your chance of winning the lottery or getting hit by lightning.
Haven't won the lottery yet, exactly. Next question. What are the advantages of and disadvantages of a knee replacement?
So a knee replacement, it's a very effective way to cure your pain. The disadvantage of it is that, and I don't want to engage Dr. Pelcher too much, but the disadvantage of it is that eventually it will wear out. So it's like getting a really reliable truck. If you take it off road and you beat it up and you don't take good care of it, it's going to wear out sooner than if you're really careful with it. And I think that's the thing about getting a knee replacement is it's not something you want to do in your 20s and 30s.
Right.
Maybe it's something you want to do, ideally in your 60s and 70s when you only have one, because doing a knee revision is, unless you're in the very skilled hands of Dr. Pelcher.
Dr. Pelcher, he keeps playing to you. In plastic surgery, we have the 10-year rule. Implants have to be changed in 10 years. All the implants we do in plastic surgery, the buttock implants and so on and so forth, it's all 10 years. Is the decade rule also true for prostheses in orthopedics?
It used to be. I say as we moved into the 90s, that 10, 15-year expectancy for hip and knee implants had gotten much better by then. So now, our whole goes between design, materials, hip and knee implants is to be able to implant them and even younger than, age 50 or 60
But it's not for life.
to last for a lifetime.
No way. Wow.
And-
So you guys beat us.
and as-
we have
as-
nothing in plastic that's for life.
As Dr. Cohen says, it always depends on how you take care of it. So we recommend, those studies that show that, there's 20 plus years of longevity with hip and knee implants.
Wow.
It's really based on the lifestyle of someone who's over 70, not the lifestyle of someone who's under 40. So if you avoid running, for instance, or other high impact activities, then you're going to get, decades of wear. I have patients who have put hip and knee implants in 20, 25 years ago.
No way.
And still,
Fast.
there's very little, if any, evidence of wear on their x-rays.
Doc, the future. What a great place to finish. How about the future? What is coming in the future? Plastic surgery is going to be no incision, all endoscopic, all stem cells, no implants. Where's orthopedics going?
I think a lot of what we're seeing in orthopedics is the start of understanding how we're going to work with biology. And, there's been a lot of really good work on mechanics and developing new type of implants. And
From titanium to what?
titanium. So, Dr. Belcher was talking about implants in knees, and one of the real revolutions was something called high molecular weight polyethylene that doesn't wear out. And in some of this, and then in sports medicine, some of the things that we've used for suture anchors, for example, where we are going to smaller suture anchors that are stronger, that are all suture, for example.
We're going to scare the archaeologists 1,000 years from now. We plastic surgeons already scared the archaeologists.
So we have another question. What is the recovery time process for knee replacement versus ACL?
So really great question. So it's a little bit easier actually for a knee replacement than for an ACL reconstruction. And if you think about it, for a knee replacement,
Wow.
You're taking parts off the shelf and you're putting it in. And you have to get over the surgery, but the soft tissue is very stable. With an ACL reconstruction, you have to let the biology work and let your tissue heal.
And that's not to say that it's easy to recover from a knee replacement, because I think oftentimes people think, oh, I've got a titanium knee. What could go wrong? So it's still a recovery process. You still do have to strengthen the joint. But I, as someone who's gone through a lot of rehab for ACL,
Starting the day after,
reconstruction,
if you don't walk,
yeah.
you're going to get a blood clot, and you're going to be the most bionic person in the cemetery.
Absolutely. So I would echo that. And I find that often patients who get an ACL reconstruction, they tend to be younger, they tend to be fitter, and they often feel better before actually the joint is stable enough for them to return to activity.
So it's interesting. I have a conversation at the 6-week return, because everybody comes back in 6 weeks, and I draw a little graph and I say, at 2 to 3 months, your graft is at 50% of the strength of what it was when we put it in. And then it starts to grow back. But now you feel good. You've got good range of motion. You don't have your strength back, but I feel great. And people go back. And if you go back, you're going to re-tear your ACL. And that's what happened in about 30 years ago in the 90s, when we used cadavers on professional football players. They'd go back in, they'd feel great, and 6 weeks later, they'd be getting another one.
And I know you guys hate math, but healing is asymptotic. So as the doctor said, 80% of healing occurs the first 6 weeks. But the rest of healing takes 1 year. Scar maturation takes a year. So you gotta be, this running around doesn't work. You gotta be patient. It takes a year to heal from anything in the human body.
Absolutely.
All right, final viewer question, and this is an important one we haven't touched on yet. When would a person need to have an injection in their knee?
Aha.
That's a really good question. So we'll use injections primarily to control people's pain. And there are a whole host of things that you can inject. And it really sort of depends on what patients' expectations are, what they want, and what their goals are.
But be careful, because the steroids, it's good to control the pain, but if you can bear some of it, those steroids are not without complications.
Absolutely. Again, everything has its upside and everything has potential challenges to it as well.
That's it.
Well, you have been a wealth of knowledge, Dr. Cohen. We are so grateful to have had you on the show.
Well, thank you so
And
much.
a second degree black belt. Oh,
Yes. Well, we didn't get to see his splits, but maybe next time. How can
I've had to do this.
how can our viewers connect with you, Dr. Cohen?
Thanks so much. If you want to get in touch with me, I'm at Golden State Orthopedics and Spine. We are a large multi-specialty orthopedic group, and you can find us at our website at goldenstateortho.com, and you can look us up and contact us there.
We are so grateful to have had you, Dr. Cohen, and even more grateful to have you at home tuning in for another episode of 90210 Doctors. We hope you learned something about the knee joint that you didn't know and have been empowered to take charge of your health and specifically your knee health.
Just because we love you.
Because we love you. We'll see you next time on 90210 Doctors.